Baby, let's talk about it. Today we're going to talk about violence in healthcare and the reason it is significantly important. And yes, I know, significantly important. There's absolutely no way that a 67-year-old nurse got critically injured by a patient in West Palm Beach, Florida. Now, initially when the story first came out, there was a lot of misinformation, but what we know to be true is Miss Lita is still alive, thank God. She's still alive, but also that this patient was a Baker Act patient. Now, in Florida, this means that this is a mental health type of situation, whether the patient is suicidal, homicidal, or having ideations or mental health exacerbations like bipolar, schizophrenia. We never know, right? So this patient was brought by EMS to the hospital, which is not a Baker Act hospital, to be housed there until they had an opening at a Baker Act receiving facility. Yes, this was an HCA facility. We'll stop there. This was not in the emergency room. This patient was transferred to a med-surg tele-floor. So one, we're not even in an emergency room where there's security all the time in emergency rooms, mostly. I'm not really sure. I've always only ever worked at level 1 trauma center, so I know they have security very close. This was on a med-surg tele-floor where those nurses were probably not trained in situations like these to be able to react in a way that other people that have done these trainings or been in situations like this know how to react. People keep saying, I just can't believe that nobody heard her. Somebody was in the room with her and they left the room and ran to go get help. By the time they came back, the nurse's face was broken. That patient had broke every single bone in that nurse's face. A 67-year-old woman now made a post on Threads about this, and somebody was like, I just can't believe that. There's no way. This sounds suspect because maybe it was another healthcare worker that did that to that woman, but they're trying to cover it up and say that a patient did it. I responded and said, what do you mean by that? What made you come to the conclusion? There were witnesses. And then she was like, oh, well, if there were witnesses, then that makes sense. Then I was like, but I'm still confused by your thought process, because how did you conclude that somebody else other than a patient did it? Are y'all confused? Do y'all not see when we post every single day that this is a reoccurring thing, that we're always getting literally verbally, physically abused, threatened, and harassed at the job? But I guess those few girls that are doing it for the aesthetic, so y'all say, going on trips and stuff and having nice gifts, luxury items, negates the fact of what millions of nurses are saying every single day. And not to mention a 911 call. The hospital administration called 911 and they described the situation and said that the nurse had gotten assaulted to the point where she was unconscious. And the person on the phone was like, oh wait, the nurse is unconscious, is she okay? And he was like, and they were like, no, we're not worried about that right now. We need to get this patient dealt with. We need to get the Baker Act dealt with. That shows you in real time, and it's evidence that they look at us as we're disposable. They don't need us. We are not respected. I'm not worried about this. A 67-year-old woman now. I would like those same people that think that nursing is an aesthetic and that we do all of this stuff and that we just don't want to work and that we're greedy, we make too much money. I want all of y'all to come to the front, because what is aesthetic? What is aesthetic about being abused? People on the outside do not know what's going on inside of the hospital, and they definitely do not know what's going on inside of the nursing profession. I wish we could just press a button and cease all outside opinions, because they never hold value and they never make sense. If you were in the situation, what would you do? Gratefully in Texas, they have passed a bill where you can be able to press charges on people that assault you, on patients that assault you, but that won't happen if you're 6 feet under. Let me know what you think in the comments, and of course, subscribe, share this video to anyone who doesn't know about the things that we go through as nurses. And as always, be sure to stay tuned for the next video.